Thank you for choosing Orthopedic Associates of Muskegon, Trinity Health, and Muskegon Surgery Center for your shoulder replacement surgery. This video will tell you what to expect before, during, and after your surgery. And it's important that you watch the entire video to best prepare for your upcoming procedure. We know that having shoulder replacement surgery can be overwhelming, but it may be reassuring to know that shoulder replacements have come a long way in the last decade. Most patients now experience much less pain and significantly better outcomes than even 10 years ago. The majority of people who decide to have a shoulder replacement return to the activities they enjoy and live the rest of their lives without shoulder pain, especially those who commit to their rehab programs after surgery. We hope you will keep that in mind as you go through the recovery process.
Now let's talk about how to prepare for your surgery and what you need to do to be successful. First, you'll need to choose a coach. This person should be someone you can depend on to help you through your recovery. They may need to stay with you the first night at home and for the first 24 hours after your discharge so you can stay safe. You'll also need to get your home ready ahead of time. This includes making sure you have plenty of groceries, and it's even a good idea to have some pre-cooked meals in the freezer. Remove any cords or throw rugs in your walkways, and if there are household items you may need that are stored up high, move them to a place that is within easy reach. Make plans for someone to help you with household chores like laundry and mowing the lawn for 3 to 6 weeks after your surgery. You'll also need someone to drive you until it is safe for you to drive on your own.
Not only will you need to prepare your home for surgery, you'll need to start preparing yourself. There are several things you can do that will have a big impact on the outcome of your surgery. If you are a smoker, stop immediately. This includes e-cigarettes and vaping. Nicotine of any kind delays healing. If you're diabetic, do everything you can to get your blood sugar under control before your surgery. Your body won't heal as quickly if your blood sugar is high. If you take pain medication regularly, gradually decrease it before your surgery. This will help the pain medications we give you after your surgery to work more effectively. Start doing the shoulder exercises on our website, oamkg.com. Look for the Physical Therapy or PT videos tab at the top of the homepage. The stronger you are before surgery, the easier your recovery will be. Make sure you schedule and go to all recommended doctor appointments leading up to your surgery. These may include a visit to your primary care doctor to address any special medical needs, and a visit to a cardiologist for an EKG if you have any known or suspected heart issues. Avoid going to the dentist 1 month prior and 3 months after your surgery. Your surgeon may have you stop certain medications before surgery. Make sure you review all your medications and supplements with your doctor ahead of time. You will need to go to a lab with your order for a blood draw 2 to 3 weeks prior to surgery.
Let's talk about your expectations and the emotional side of shoulder surgery. It's important to understand that shoulder replacement can provide early pain relief, but full recovery takes 6 to 12 months. If you go into this with a positive attitude, set goals for yourself, and focus on what you can control, your odds for a great outcome go up significantly. You will have some pain after the surgery, but you'll also have access to several tools to help keep your pain at a tolerable level. We will show you how to position your arm to reduce pain, and you'll get a prescription for pain medication. Icing after your shoulder surgery is key. You can use an ice pack, a bag of frozen vegetables, or you can purchase an ice cooling unit that provides continuous cooling at the medical equipment store at our office. Remember, the goal is not to be pain-free, but to keep your pain at a manageable level.
The day before your surgery is an important day. Make sure that your home preparations are complete. Make sure that you wash your sheets and your towels and your clothes. That helps reduce the chance of infection when you get home. You'll also be given instructions on how to wash your body prior to surgery. Make sure that you do that. Cleanliness is the best way to prevent infection. When you pack for the hospital or the surgery center, make sure that you bring comfortable, loose-fitting clothing. Bring a list of current medications, and if you were given a sling at the office, bring that with you. Bring your rescue inhaler if you have one, but don't bring other medications. If your surgery plan includes an overnight stay at the hospital, And if you utilize a CPAP machine, remember to bring that. Regardless of where your surgery is scheduled, it is important that you leave all valuables at home. Also, make sure you know which entrance you're going to be utilizing when you arrive for your surgery. At Trinity Health in Muskegon or in Grand Haven, you'll be utilizing the main entrance. At the Muskegon Surgery Center, please utilize entrance B. Once you get checked in, our staff will guide you through all of the paperwork and final arrangements that you need. Surgery takes about an hour. However, you will be away from your family for several hours. It takes a little time to get you ready in surgery, a little time to get your dressings on and wake you up, and then to do early recovery. So it'll be a few hours until your family sees you again. Make sure that they know that, and make sure they understand everything should go just fine.
After your surgery is over, you'll wake up in the recovery area. You'll have an incision over the shoulder you had replaced, and it will be covered with a dressing. You may have received a nerve block as well, which usually wears off in about 18 to 24 hours, but can sometimes take longer. You will experience some pain once the nerve block wears off, especially the first week after surgery. Remember, you'll have several ways to keep your pain tolerable, such as oral pain medications, cold therapy like icing, and positioning your arm in a way shown to you ahead of time to help minimize the pain. You can also learn how to adjust your sling by clicking on the Shoulder 2 videos on the physical therapy video page at oamkg.com. Believe it or not, getting up and moving can also help decrease pain. This is one of the reasons we recommend you start walking soon after you get home. You will start 4 simple shoulder exercises soon after surgery as instructed. These can be found on the PT videos page on our website as well. Preventing complications is always a priority after your surgery. You'll be asked to sit in a chair and do deep breathing exercises and ankle pumps to help expand your lungs and avoid breathing and cardiovascular complications. You may need a stool softener for constipation. Moving and drinking water will help you avoid getting constipated as well. At first, you may also be more comfortable sleeping in a recliner chair or propped up with pillows in bed or on a couch. Don't take your dressing off unless your doctor says it's okay, and don't touch your incision or allow anyone else to touch it. You can shower, but don't soak or scrub your incision, and pat it dry with a clean towel. Do not use cream, lotion, or ointments on your surgical site. You should wash your hands often to help prevent infection also. We understand that your pets may want to stay close when you get home, but don't let them near your incision. That means not letting them sit on your lap or getting into bed with you, at least for the first 2 weeks after surgery.
We'll send you home with a short-term prescription for pain medication, and it's important that you take your pain meds regularly as prescribed, especially for the first few days after surgery to stay ahead of pain. You will be able to gradually wean off prescribed pain medication over the first 1 to 2 weeks. There are many over-the-counter medications for breakthrough pain after prescription medication is no longer needed. We can discuss your options at your first office appointment following surgery. You'll be asked, either by phone or email, to complete a quick survey a few times during your recovery. This tells us how your recovery is going, so it's important that you respond right away. We'll also give you instructions on a few first-step exercises for your shoulder and restrictions on activities. Call our office if you have any questions.
Thank you for taking the time to watch this video. Following these steps will put you on a path to a smooth recovery. And Orthopaedic Associates of Muskegon, Trinity Health, and our surgical facilities will work together to provide you with an outstanding experience for the best possible outcome. We appreciate you trusting us with your care and the care of your shoulder. We are always here to answer questions and help you along the way.